All right, let's talk about today's topic, and then we're going to get into a live Q&A. So if you've got any questions today, make sure you type your questions in the chat there, and we'll get to as many as we can. I got about 50 minutes after we talk about today's topic on why your Social Security check is probably incorrect. 4 reasons. My name is Ed Weir. I'm a former manager of the Social Security Administration. I've taken hundreds of thousands of disability claims, retirement claims, survivor benefits, and I know all the mistakes out there that people are making. And that's why I do a live Q&A pretty much every day for the past 3 months. And going to continue doing it in my semi-retirement to make sure you're getting everything you can from Social Security. Social Security is not doing a great job. They're understaffed, 27-year low of staffing. So they're unfortunately not doing a great job in terms of helping people get the correct benefits. So that's my new mission in my semi-retirement. All right, so the 4 reasons your check is probably wrong. Or if you haven't filed yet, 4 reasons your check is probably going to be wrong. And so this is going to be excellent for those people that haven't filed yet, because you can make sure your check is right from the beginning, so you won't make these mistakes. All right, number one is it was never right. So when you filed last year or 10 years ago or 20 years ago, you missed some things. And unfortunately, with the pandemic and everything, what used to happen is when you filed a claim, when I was a claim specialist and I took retirement claims and everything like that, a lot of them were in office. Probably about 70-80% of people came into the office. The other 30% called over the phone, and we did it on the phone. And when it was in the office, it was perfect. Sat right in front of the person, and you went over everything. And most importantly, you went over their earnings record. This is where your people are making a lot of mistakes, because your benefit, your monthly benefit for the rest of your life, is based on your high 35 years of earnings. We're talking about retirement benefits and for spouses and survivors, your high 35 years of earnings. It's not your last one or last five or last three or anything like that, or last 10. To get insured for Social Security, you need 10 years. But the actual calculation is based on your high 35 years of earnings. So if Social Security has the wrong numbers, then you will have the wrong benefit for the rest of your life. And how do you make sure Social Security has the right numbers? Well, if you're young, and I really want young people to prepare for this, every time you do your taxes, you finish your taxes in April or whenever, that does not end your tax season. Please, after you file your taxes, a few weeks after that, go into My Social Security, SSA.gov, and go in there and make sure your earnings are correctly reflected. Because what happens is Social Security doesn't get that information until you file. You send it to the IRS, you pay your FICA taxes, the IRS sends it to Social Security, and Social Security adds that to your record. Somewhere along the way, those get missed. Somebody types in the wrong Social Security number, or the name is incorrect or whatever, and there's billions of dollars in what's called a suspense file. So they're just out there in limbo waiting for someone to raise their hand and say, hey, those are my earnings. So if your earnings are not correct, your benefit amount will be incorrect for the rest of your life. And don't discount earnings early in your life, because these are indexed. Your monthly it's annual indexed monthly earnings, average index monthly earnings. It's basically, if you made $20,000 when you're 25, and now you're 65, and you're like, oh, I made $80,000 last year, so that $20,000 when I was 25 doesn't really count. Well, that was many decades ago, and that $20,000 is probably worth $100,000 now. So that's one of your high years. So don't discount stuff early in your life, because it actually might be more. How do you get that checked? Again, going to socialsecurity.gov, check your earnings. And usually, my experience doing this a million times is it's usually a gap. It's a 0 year where the earnings are just completely missing. So if you're like, well, I don't know where, I was, 10, 20, 30 years ago where I worked. It's easy if you had a consistent work history during that time. So like in 81, 82, 83, you worked in a particular place, and then everything is good, 81, 82, but 83 is just missing. It just says 0. So that means you probably work for the same company and someone just typed in the wrong social security number. So that's actually easy to fix. You just call Social Security and say, hey, in 83, I work for the same company I did in 82, and they will find the employer identification number, look in there and say, oh yeah, Bob Smith. Oh, okay, here you go. Yeah, they just typed in the Social Security number wrong. Yep, here's your earnings, same company, same address, yada, yada. And they pop it into your record. And if you're currently receiving benefits, they recalculate that automatically. So if they correct your record and you've been receiving benefits for the past 5 years, and your corrected record gets you another $5 a month or $10 a month, they'll give you that $5 or $10 a month all the way back to day one. All right, so earnings record, very, very important. Military, it doesn't make a big difference, but hey, every buck's a buck. Being an old Marine Corps sergeant myself, like to pay for all those miles on my knees. Running. Okay, anyway, bad reference there. But in terms of the military, if you served within certain time frames, you get a little bit extra benefits. Not a whole heck of a lot. It's $300 added to every quarter you served in the military. But hey, every buck's a buck, right? All right. Number 2 is you filed at the wrong time. What do you mean by filed at the wrong time? Well, you filed at 62, and then you actually should have waited, but you were told that you didn't, you couldn't wait, or you filed at 65 because you thought it was mandatory to file at 65, but that's only for Medicare under certain conditions, or you didn't know what your full retirement age, or you should have filed, delayed retirement credits, which is delayed retirement credits. Every month you delay receiving your benefits after your full retirement age, you get an extra 8% per year up until you're 70 years old. And I talk to people all the time. They're like 70, 72 years old and haven't filed for benefits. No, your benefits stopped increasing based on waiting at 70. You just lost 2 years of benefits. So make sure you file at the right time, and nobody knows when is the right time for you. You see a lot of videos out there that, I wouldn't file at 65, I wouldn't file at 62. 62 is the best year, 65 is the best year, full retirement 70. It's really dependent on you, your health, longevity in your family. Number one, whether you need the money, you've got other income, because there's an annual earnings limit. So there's a lot of variables. So you have to make sure you're filing at the right time for your specific case. And I do a live, as I'm about to start here in a little bit, I do a live Q&A several times a week. And if you have questions about that, make sure you join. Number 3, here's a big one. Here is where we're finding tens of millions of dollars every single week, every single month of lifetime benefits for people. They filed for the wrong benefit. So they filed for retirement benefits, but they actually should have filed for survivor benefits to begin with, because you can actually not file for your own and go ahead and file for survivor benefits and let your own increase, or vice versa. Or they filed for retirement benefits but didn't file for spouse benefits, or ex-spouse benefits, or independently entitled divorced spouse benefits. Or they filed for retirement benefits but should have also filed for disability benefits. That's a big one. Or they filed for disability benefits and they should have actually filed for retirement at the same time. So there's a lot of different variables. Or they should have filed for auxiliary child and care. So there's a lot of different claims, but people, when they think of Social Security, they think of retirement and a Social Security card. And they don't realize, there's disability and spouse benefits, independently entitled divorce spouse benefits, and all the rest of it. And so you want to make sure you file the right time at the right benefit. And number 4 is things change. So your check might be wrong. You did everything 100% right when you first contacted Social Security a year ago, 5 years ago, 10 years ago, whatever the case may be, and did everything right, but things change. So you were married and that person passed away, and there's survivor benefits out there waiting for you that you didn't know about. Or you divorced spouse benefits, or you filed early retirement and then you became disabled, and you think, well, I can't, file for disability benefits because I'm already receiving retirement benefits. That's not correct. So things change, and when you make some money, you get an inheritance or something like that. And when you hit your full retirement age, you say, well, I actually don't need the Social Security money. Wonder how I can increase it. There's a program called voluntary delayed retirement credits where you can stop your Social Security benefit at your full retirement age and let them increase until they're 70 years old. That's one not many people know. And a lot of Social Security employees, if you walk in there and say, hey, I want to do this voluntary delayed retirement credits, or I want to do independently entitled divorced spouse. I send people into offices all the time and they go in the office, and unfortunately, there's so many new staff, and the front level staff at the front windows are generalists. They're not experts in retirement and disability and stuff. So unfortunately, they're giving out incorrect information. So people, contact me through this live Q&A the next day and say, hey, I went into the office and like you said, and I asked for this, that, and the other, and they said this, and then I tell them how to approach it again and find someone that actually can help them in that particular office. All right, so those are the 4 things that just might make you lose money for the rest of your life. And not only you, a lot of times if you file incorrectly, or miss things, that's going to affect your spouse and your surviving spouse as well. So all of those things kind of work into kind of a 3D chess set sometimes. You're looking at this, but you're forgetting about this other thing. Same type of thing with Medicare and Medicaid and SSI, which is a supplemental security income. And so there's a lot of different variables in there. Social Security has over 20,000 pages of policy. And unfortunately, with this new Supreme Court ruling, it's going to get even more complicated, and staffing at Social Security office is going to get even worse. So not a lot of help out there. All right, so I'm going to continue to do what I'm doing, and let's go ahead and start the questions. Let's see what we got here. Asking for a friend. Social Security office staff did not change his DAC address. So this DAC is disabled adult child. Is his DAC owes overpayment, even though he called Social Security office to change the living situation of his DAC? All right, yeah, so living situation on a DAC doesn't matter. A DAC is a disabled adult child, and a disabled adult child is getting benefits off of SSDI or retirement or surviving benefits or something. So yeah, that's not a means tested system. What possibly you're talking about is a living, as soon as you see living situation, that sounds like it's an SSI, which is supplemental security income, which is the welfare-based program that Social Security administers. So okay, I'll just answer it based on you say living situation. Yeah, if you have an overpayment because your living situation changed and your rent was less or more, or whatever the case may be, then yeah, you have an overpayment. I just did a couple of videos on overpayments because the policy on overpayments changed a couple of months ago based on an excellent Anderson Cooper 60 Minutes episode. And it's a lot easier to negotiate those now, a lot easier to set up a payment plan. But unfortunately, 2 things have to be met to get an overpayment waived. Number one, it's not your fault. So you called and all that kind of stuff. So it sounds like it's not your fault. And both of these hurdles have to be jumped. Not your fault, and you don't have the ability to repay. So if the person is actually receiving SSI, so that might be, a viable strategy to get it waived. But it depends on how much the benefit is. Sometimes they withhold $10, $20 until that particular overpayment is repaid. You are right. Some Social Security staff are clueless. My staff was awesome. I had close to 100 employees, and we probably did more training in my office than any other office. Yeah, we did quite a bit of training. But the problem is, the policies changed, and now with the Supreme Court ruling, the policies are going to change. You get more complicated. It's going to, and that spending all that time on training is good, but it takes away from, time at the window actually helping people, picking up the phones and all the rest of it. So yeah, it's Dr. Ed, positive experience. Okay, here we go. I like it. Went to local Social Security office Wednesday for marriage certificate and SSA issue, or for Medicare. Both were handled in 90 minutes. Friendly, not overly busy. Had earnings error from 2000. Suspense file check and adjusted. There we go. I like it. So somebody actually went into an office and said, "Yeah, I went into an office and asked the, I knew the EIN of the company I work for, and I said, please check the suspense file." And the person said at the back and at the other side of the window said, "No, we don't have a suspense file." Again, that's frontline people. That person was probably just hired and stuck at the window and wasn't fully trained. But yes, perfect. I like it. Good deal. I like to hear that. I worked my entire life, never made a whole lot of money, I assume. Lack of education on my part, just hard labor. My check is $1,518 a month. Sound right? Yeah, it really depends on how much you paid in 30, over 35 years. But the average check, what, 1900. So, yeah, yeah. My dad was a long distance truck driver all his life and never made a whole heck of a lot. Um, if I take my benefits at 64, $2,000 a month, my wife takes spousal benefits at 62 a month. If I pass at 65, will she get my 2,000 and her benefit drops? She has no work history. Yes. So if she is if she is her full retirement age when you pass, then yeah, she'll essentially get what you were receiving minus her own. Yeah. So it's kind of drops. Yeah. So that she doesn't get the $2,000 plus the $800. She continues to get her $800 plus another $1,200 from you for a total of $2,000. So a lot of people misunderstand when I say, yeah, she gets the two checks, and but they think, oh, Ed said you get two checks. No, there's one minus the other one. Yeah. All right. I worked my whole life, but went on disability late 50s, and I only get $995. Seem pretty much screwed. Women, women pretty much screwed. Yeah. Again, it really depends. With $995, and you wouldn't be eligible for SSI because the max in SSI is $943. So you're just getting SSDI. But if that's all the money you're getting, make sure you watch the video. I just did an updated and expanded one on living on Social Security alone. So make sure you watch that. It's like 45, 46, 47 different programs that might help you out. Definitely make sure that you are part of that Medicare savings program where Medicaid in your state is paying for your Part B premium. But watch my video on that. And yeah, there's tons of ideas that just might make your life easier. What Supreme Court ruling? Someone asked. I just got on. Yeah, it overturned the Chevron deference. Basically, the Supreme Court said that if there was a lawsuit or something against Social Security, then the judges had to defer to the experts in Social Security and the experts in the FDA and experts in all the different agencies. But now the judges can just kind of make their own decisions, and which is fine. Civil service bureaucrats were not elected. Judges aren't elected; they're appointed for life. So it's not really democratic thing that we can make a decision on. So either way, but the problem is then now there's going to be judge shopping. There's over 600 federal court judges throughout the country, and what's going to happen is Wall Street and pharmaceutical companies, health insurance companies are going to shop around the country and find a sympathetic judge and say, hey, this is the new regulation, and everybody should Medicare Advantage is mandatory, or whatever. Yeah, we don't know what's going to happen. We don't know, but it's not. It's a change that changes something that's been around for 40 years. I would argue going all the way back to 1935. Social Security is operated in this particular field one way, and now it all changes. So everything is going to be very, very strange. But I'm going to keep up all on it. And if there's any change that might affect you, I will keep you updated. So make sure you subscribe and all that kind of good stuff. Is SSA.gov accurate? Yeah, pretty much. It's as accurate as your earnings record, but future projections are just that, future projections. If you're 55 years old and you look at your earnings record and it says, hey, when you're 67, you're going to make $3,000, and then you stop working for the next 17 years, then it's 100% not accurate, because what it does, it projects forward in, okay, you made this much last year and this year, and So we're going to project forward that you're probably going to continue making that amount for the next 17 years. And so there's how they come up with the $3,000 number or whatever. So yeah, pretty accurate. You can never get a 100% accurate determination of your benefit amount until you actually file a claim. Once you file a claim and get the letter, and the trick is if you know, some people are kind of OCD and they want to know exactly down to the dollar how much they're going to get, you'll never know unless you actually file a claim. But you don't have to push the button. You don't have to have it adjudicated. So if you just want to check out your options, you schedule an appointment, you get the appointment, a phone appointment, in-office appointment, and you file the claim for survivor benefits or retirement or spouse benefits. And then the claim specialist runs the numbers and they tell you what the numbers are. And you can say, okay, how much of those numbers if I wait a year? And they'll tell you. And then you can decide at that time, oh, okay, well, never mind. I don't want to start it today. I'll call you all next year. And Social Security employees, the claim specialist in this type of instance, yeah, they're super happy because they can go back to their desk and work on the other 400 cases they have pending. So it's not like they lost a sale. They're actually excited. It's like, yeah, I'll think about it. Oh, cool, bye. So yeah, so there's that. So don't sweat. Yeah, not pushing the button at that time. SSDI is calculated on the money you earned. I had a very high salary, so my SSDI is very high, 3,600. Yeah, 3,600. That's yeah, pretty much one of the highest benefit amounts in the 36. Yep, good. Yeah, you worked a few hours in your life. If you are on SSDI and at 67, you go on your regular Social Security, should it be more or less? Nope, it's exactly the same. And you don't have to do anything. That is 100% automatic. When you are on Social Security disability insurance, when you turn your full retirement age, your Social Security disability is automatically switched from retirement or from disability to retirement benefits. The check stays the same and everything is the same. So a lot of people don't even recognize the change. Let's see here. Irma, I'm 64, working and receiving survivor benefits part of the year. When I retire, can I get both? You'll get the higher, whichever is the higher. So if yours is the higher, you can switch to yours. Or if your survivor benefits is the higher, then you'll just stay on that one. So yeah, you can't get both checks in the way you're thinking. If you file for retirement and get benefits on your own and then file for survivor benefits, you get the higher amount minus your own. So you get kind of technically two checks, but you don't get two checks. It's kind of confusing. People misunderstand that all the time, but that's the system. But Irma, what I would recommend on you, if your benefit amount is close to your survivor benefit, I would just stay on survivor benefits until you hit your full retirement age. And if your benefit on your own is higher, switch or wait even more, because your benefit on your own record, if you haven't touched it, is going to continue to increase until you hit 70 years old. So you're going to get 8% more. So that's 24%. And at 70, you might be $100, $200, $300, $400, $500, $600 more than your survivor benefits. So yeah, just make sure you find out how much benefit on your own record is, and that way you can switch when you think it's a good time. How long can you work and receive SSDI? You can work as long as you want, but you have to stay under certain limits. I just did a video on working and receiving SSDI. So you got the trial work period. You can work 9 months and make $1 billion a month. After that, there's an extended period of eligibility for 36 months where anytime you go over the SGA, the substantial gainful activity, they stop the check for that month. So, but as long as you stay under those limits, you can continue to receive SSDI and work forever. Yeah, and the SGA this year is $1,550. My ex-husband and I were married for 14 years. When he passes, will I get a portion of his Social Security? Yeah, if you're currently not married or you remarried after 60, then and his benefit amount was higher than yours, then absolutely. Do you recommend me making an appointment and going to an office to do this, right? See if I'm entitled? Yeah, I mean, you can, if you don't make an appointment Then you just walk in, and then you have to go through the first level and talk to just one of the frontline people before you can maybe see a claim specialist, a retirement or survivor claim specialist. But it's always good in that particular case to schedule an appointment, either an in-office appointment or a phone appointment. Either one of those is fine. Either one of those is fine. Husband is on SSDI. If he passes, do I get survivor benefits? He's 47. Yes, if you're 60 years old, at least 60 years old, and not married or married after 60. And again, you still have the annual earnings limit you have to contend with. I was getting SSD and Social Security survivors. Does Social Security survivor increase which I reach FRA? No. How long to get approved for SSDI? Anywhere from anywhere from a day to 3 years. Yeah, sorry. That's actually, if you've got a terminal illness, those are approved sometime the same day or the next day. If you're denied in the initial and the recon, and then yeah, it could. We had someone on here yesterday that what I think was 3 years. She was finally approved. Let's see. Yes, please don't forget to hit the like button. That's how this information, gets out there to help your community and share with your friends and family. And so if you've got anybody out there that is wondering whether they're getting all the benefits they're entitled to, make sure you share, and they join my live Q&A, and we'll make sure they are good. For a friend, awarded disability by ALJ, administrative law judge, not sure what month it was this year in April. SSA compensated her attorney. She still not received overpayment. Should she be calling for attorney or SSA? Yeah, it really depends on the attorney. Some attorneys like, well, I got my money, so done. But yeah, either one of those is fine. That means they've adjudicated the claim. They're starting to send out money. So if they've already paid the attorney, there's 7,200 or whatever it was, then the other check should be coming very, very soon. But if it hasn't, yeah, they call up Social Security and find out what's going on. If you call the attorney, oh yeah, I'll call them next week and I'll put it down, and so it just might be quicker for you to call them. I received my Social Security statement last year. It told me what I would get if I became disabled at the time. When I received it, it was correct, so I was approved, got that amount. Plus the COLA increase for 2024. Awesome, good deal. Yeah, sometimes they are right on the button, but if you've got a lot of variable and your work and stuff like that, then they're, again, future projection. So good. Wow, we're getting some good stories today that Social Security is doing some good things. I like that. I'm a big supporter of Social Security and Medicare, and my job, my new third mission in life is to, again, help you get all the benefits, you, your family, loved ones get all the benefits you're entitled to, and make sure your kids and grandkids can get the benefits, and make sure it's still around for them. Hello, how can someone that worked several jobs over 25 years, not making that much, get 1,700? Yeah, it's not over 25 years. It's over 35 years. And yeah, it really depends on how much they paid into Social Security. I used to get people come in all the time, and I say, okay, your monthly benefit amount is this, and they would say, well, I've got this coworker that I've worked for the past 5 or 10 years, and they get more than I do. And it's like, okay, how long have you known this person? For 35 years? Oh no, I just, I've been working a few years and we're making the same amount of money. Again, it's over the high 35 years. So maybe, 20 years ago, they were, banking it, making a lot of money. So unless you know that person for 35 years, it's hard to know what their earnings record is like. To follow up on previous question, if I get $2,000 benefit at 64 old and non-working spouse gets spousal benefits of 800, and I pass at 65, to clarify, she keeps her, yes, yep, that is correct. Plus 15 years guard and 1 year full-time flight training as well as officer training. Does it have any effect on spousal Social Security for divorced spouse and his retired captain? Yeah, whatever job, doesn't really matter what it is. So Yeah, again, it's the high 35 years, and spouse benefits are, based on the work record of the other person. So however much that person made throughout their life, it doesn't matter what job they had. Um, it's based on those earnings. I was married for 17 years and ex married two times after. Can she get spousal benefits from my SSI? Yeah, from SSA. Yeah, the if you were married three times for 10 years or longer, each one of those ex spouses can be entitled to benefits on your record if their benefit amount is less than half of yours and all the rest of it. Yep. So, and one doesn't affect the other. So you could have three ex spouses receiving benefits on one record, and they're all receive the exact same amount, and one doesn't reduce the other. Jay, turned 65, 2023, signed up for only Part A. Still working, but will retire in 2025. Will Medicare use my Maggie income from 2021 since I started the process? Yeah, they will use the 2021. They'll always go 2 years back. But remember, um, sign up for, but still working, but retire. So you're going to retire. So retire in the sense of start collecting your Social Security benefits, or retire in the sense of stop working. So if you get that IRMA, that extra Part B premium amount added on to your Part B premium, and because it's based on 2 years ago, and if something happened, what's called a life-changing event, then you get divorced, or you quit, you stop working, or you reduce your work, or whatever the case may be. Then you file an SSA 44, and they will adjust it, but you only pay that IRMA for that 1 year, unless of course the next year you make the same amount of money. So what, 103,000 for single, and over 206,000 per year for married couple. um, so, would they increase my disability if my living arrangements has changed? Yeah, so that's SSI type thing. Yeah, if you're paying more, then yeah, living arrangements do affect your SSI. Um, However, they changed the policy within the last 6 months. They changed, it's called ISM, in-kind support and maintenance. So they changed it in terms of food, and they are now changing it in terms of rent. So it's a little bit more beneficial. So I think it's a good policy that they changed. But that the rent part doesn't start until September. But yes, you should always report living arrangement changes, because if you don't and they catch it, then you'll have an overpayment, and you'll have to pay that overpayment, and it's a big pain in the butt. So it's just go ahead and call them up and say, hey, I moved and my rent is more or less, or whatever the case may be. Can a widow collect on her first ex-husband benefit? She was married 11 years, and if her second ex-husband passes away in the future with a higher benefit, switch to the higher benefit? Yes. Yep. So whichever is the higher benefit, again, married to the person for 10 years, or married to the person when they passed, if you were married at least 9 months, absolutely. My cousin had been sharing your vid. She has 300,000 plus subscribers. Wow. All right. Yes. That's what we need. Need an influencer out there that has a lot of subscribers. Yeah, I got to, like, Mr. Beast, the number one guy, YouTuber, his videos there where he gives out $100,000, they get like millions of views. And I'm like, yeah, hold our beer. We do that on a weekly basis. We find money for people, and hundreds of thousands of dollars over their lifetime. And so, yeah, Mr. Beast ain't got nothing on us, except for people who are actually watching his videos. And yeah, I haven't hit it yet. So, we're still trying. That's why I'm doing this every day. It doesn't help if people don't get the information. That's the problem. There's just not enough information out there. Correct, authoritative information. So I have zero earnings, but I was not grandfather after WEP started. Yeah. All right. Are you aware of the proposed 2025 changes to Social Security? If so, what are your thoughts? Yes, I did a video on that a few days ago, and that's this kind of scary part. Is if you look in Project 2025, over 900 pages, there's nothing said about Social Security in the sense of, there's a few things about Social Security, but it talks about Social Security numbers and, but it doesn't talk about retirement or survivor benefits or solvency or the trust fund or anything like that. And that kind of scares me. It's either that they don't think Social Security is an important thing to talk about, there's 100 other things that they talk about, or their plan is so unpopular and nefarious or whatever the case may be that they don't want to tell anybody. So either one of those reasons kind of scares me. So Jay, stop working, not collect until 70. Okay. Yeah, that's yeah, don't wait until after you're 70 because your benefits don't go up. Um, let's see. Oh, okay. Someone's answering someone else's question. Is military pension counted in Social Security for ex-spouse? No. I started Social Security before he got his pension, married 50. Yeah, military pension doesn't affect anything. Is ex-wife portion of pension separate from Social Security? Married 15 years, can modify the divorce decree, divide pension without. Yeah, it's a pension again, unless that pension is from a non-covered employment. That means what this person was talking about in terms of WEP, windfall elimination provision. So people that receive a pension from a state, city, or local government that did not pay into Social Security, those are the only pensions that affect Social Security. Everything else, no, doesn't affect it whatsoever, because Social Security wants you to have pensions and savings because, Social Security, pensions, and savings, three legs of the retirement stool, right? Let's see. Mhm. All right. Hello, can you have? All right, answered that question. If you have kids under 18, does it hurt your chance of getting SSDI? Absolutely not. I'm on disability, arthritis, and bad knees. I'm 63. Will they someday try and see if I'm better? Yeah. Well, you're 63. And though you're talking about CDRs, the continuing disability reviews, medical CDRs, that they stopped this year because of the staffing crisis. They're not going to do CDRs until October. So, you might be 64 by then. So there's probably not a good chance. Yeah, you probably won't get a CDR. But if you do, don't worry about it. Just fill it in, send it in. Fill it out, send it in. Don't sweat it. Social Security stresses people out way too much about CDRs. So it's unfortunate. Watch my videos on CDRs and it gives you all the inside information so you don't stress. If you're on disability, you've got enough stressors in life, being on disability and medication and finances and all the rest of that stuff. So don't stress about CDRs. I'm new to SSI. Do we get raises? SSI is the welfare-based program. And yes, the max you can get on SSI, as you know, is $943. And when COLA comes out every year, yep, you get COLA just like everybody else. Wife forced me to early retire at 62, get reduced benefits. Now she's divorcing me after 42 years. Wow. That was, yeah. If you haven't worked in over 12 years, can you still draw SSDI if approved? Probably not. It really depends, though, because for Social Security disability insurance, you have to be insured. So you had to pay into the system for at least 10 years, and you have to be currently insured. That means you had to work 5 out of the last 10 years. But that's 5 out of the last 10 years, and when they determine you're disabled. So if they determine you were disabled 5 years ago, then you might be currently insured. But yeah, that's, it doesn't hurt to try. I'm confused. I'm not seeing the questions you're answering. Yeah, I've got TikTok, and then I've got LinkedIn and Facebook and YouTube and Instagram, and so let's see. I'm answering questions on 5 or 6 different platforms. Moving from Washington to Ohio, what do I do about my drug plan? Do I need a new agent? Yes, if you move, then so if you're asking about your drug plan, then you have a Medicare supplement plan, probably like an N or a G. So you need to get re-rated for your new area. And yes, you do need a new drug plan because it doesn't work in another state. So yeah, if you need help, I've got a go on my front page and there's a link tree. You click on that and it says I need one-on-one Medicare help, and click that, and then we can find someone. You said in Ohio, we'll find someone that's licensed and contracted in Ohio to give you a call and give you all your options, and that's 100% free. All agents and brokers, they don't charge you anything. What is SSDI? SSDI is is the disability, Social Security disability insurance. Let's see here. Mhm. Okay, let's see. Okay, I already got that one. Thank you for your perspective. You're welcome. A few days ago, I found out the ALJ for my hearing got changed, and she has a very good approval rate. Oh, okay, awesome, good deal. Yeah, that's why I like to use. I always recommend if you're going to use a lawyer, which I do recommend at the third stage, at the administrative law judge stage. I do recommend a lawyer. I always recommend local lawyers that know the local judges and the local doctors, and so that if you got a good local disability lawyer, they'll say, "Oh, that one, I know exactly how to talk to that judge." And so what that judge is looking for, so that helps, rather than those national ones that they just you know they don't talk to you until like 5 minutes before your hearing, and they don't know anything about. Yeah, so always go local. Medicare reports $1 billion in losses from fraud equipment abuse, such as knee braces. One doctor ordered 20,000 braces and never saw the patient. Wow. Yeah, that's yeah, and yes, that's another thing that we need to do, to be vigilant, to make sure that our money, because that's our money, all those years of FICA. So if you see anything incorrect, report it. You know, and that goes, with if you're on original Medicare or if you're on a Medicare Advantage plan or whatever. There was a big thing in Medicare Advantage. Medicare Advantage plans get more money if the sicker you are. So a lot of them were caught. Not a lot of them. I want to make sure I don't get in trouble with Medicare Advantage lawyers. Some companies were upcoding, where you go into an office for an earache and they upcode you for something more, like cancer or something. One actually had, prostate cancer, and it was a female. So yeah, and so the Medicare Advantage company got more money. So there's a lot of fraud there. So we need to stay vigilant. So let's, if we see that, please report it. It seems that inflation actually decreases in the summer fall time. Is that partially for the COLA to be less? The COLA for less next year? Yeah, the whole COLA estimates. Yeah, that's just clickbait right now, and you hear it all the time. Oh, COLA's on pace to be less or more, or whatever the case may be. It nothing happens until October, because it's based on the third quarter. So yeah, nobody knows what it's going to be until it actually comes out, till the Department of Labor Statistics or the actuaries and everybody makes the calculations in October. So anything else is horse racing, I guess. Is I wonder if there's I'm sure there's in Vegas, I'm sure you can bet on COLA increases with maybe old Jimmy the Greek spread or something like that. And so I don't know. Remember Jimmy the Greek. Will this live be posted for my mother to watch later this evening? Thanks, very informative. Yeah, absolutely. Yes, all the lives are posted, so it's recorded right after. Yep, it's recorded and posted right after. Yep, yep. Will you please explain what SS is based on? Highest of how many quarters of earnings? 35 years. So Social Security is based on your high 35 years of earnings. I just spoke with a local Social Security person today about disallowing Part B. No problem. They said, yep, no problem whatsoever. So you want to disenroll from Part B, but remember, hopefully they give you that form. It's what, a 1763, where you have to fill it out. It says, yes, I understand that, if I don't have health insurance from work, then I will be penalized 10% for every 12 months I did not have Medicare. And then there's the general enrollment period. The only time you can sign up for is January, February, March. But if you stopped Part B because you have health insurance from work, then you are good. No problem at all. Besides prescriptions, what and how does the extra help cover? The extra help with prescription drugs is just that, also called the low income subsidy, LIS. So it just helps prescription drugs. And it's helps a lot of people with prescription drugs. And if you have that, if you have the extra help with prescription drugs and a Medicare Advantage plan, with Medicare Advantage, you can only change your plan, usually in October, November, December. But if you have extra help, or if you have, Medicaid as well, there's several times a year that you can change your Medicare Advantage plan. So you have special enrollment privileges if you have that extra help. So if you're not happy with your Medicare Advantage plan, reach out and see if there's anything better. Or Medicare Advantage and all that, if you want help, because in next year is going to be the big changes for Medicare Advantage. A lot of stuff happening. And if you've never checked your Medicare Advantage plan before, 2025, this coming October is the time to do it. So if you want help from my team, make sure you click that button, and there's a button there that says one-on-one Medicare help. You open it up, and there's an option where it says, hey, I'm good now, but put me on your list for October. And then we'll reach out to you in October, schedule a time, check out your plan, check out the other plans in your area, give you your options, and you decide what you want to do. If you want to just let it ride, then you don't have to do anything. But if we find you something better, then it's a beautiful thing. If a widow collects on her first husband's benefit, but her second, who is 6 years younger, benefits more in the future, can she switch? Yes. Yeah. I think that was a repeat question. Wishing you the very best outcome on your ALJ hearing. All right. Yes. I like. We got a great team, great community here. Everybody looking out for each other, answering questions. So I like it. Is SSDI and DAC the same funding? Yes, it comes from the Disability Trust Fund. Yes. My sister received an overpayment on her rent and now has to reapply for SSDI. Overpayment on her rent. Yeah, I'm not sure. SSDI, that's not a welfare-based benefit, so rent is not an issue whatsoever. Do you have to have Part B if you have TRICARE Prime? Yeah, TRICARE, I would reach out, but yeah, usually TRICARE, they make you sign up for Part A and Part B because, it's a bureaucratic agency and they're trying to save money, so they move the costs over to Medicare. So, question 62, or wait. Wow, there's a loaded question. There's about 400 other questions. Do you need the money? Are you currently working? Are you healthy? How long does your family usually live? All that kind of different stuff. So AARP reports that Part B will not run out in 2035 because people are paying the premiums to keep it going. Yeah, I certainly hope not. I think Medicare, definitely some stuff needs to be changed. I think they should definitely add dental, vision, and hearing to Medicare. And if it was me, I would make like a Medicare Part E or F, where you can just, pay a little bit extra, like a Medicare supplement plan, and get that 20% gap covered, so you didn't have to deal with an insurance company again. If Medicare covers it, then Medicare covers it. I'm going to do a video later this week, probably on the Medicare Advantage versus Social Security Advantage. You probably never heard of Social Security Advantage. It's the first step at privatization of Social Security. So I'll talk about that. And if Social Security Advantage copies Medicare Advantage, you're probably not going to like what we talk about. But sorry, but what is Social Security SSI? Yeah, a lot of acronyms there. So Social Security is Social Security Administration, SSA. SSI, Supplemental Security Income, is the welfare-based program that you can get if you're disabled or 65 and older. SSDI is Social Security Disability Insurance, which is disability based on what you actually paid into Social Security. All right, let's see if I'm missing any question. Oh, I think I jumped one here. Joyce, I'm turning 60 in September. I'm still married, separated 20 years. He's alive. Can I claim his benefits? No. Um, the only thing you can do at 60 is collect surviving spouse benefits, but he is still alive and kicking, and you are remarried. How will Medicare know if your income increased if you are not drawing Social Security at your retirement age because you're waiting until age 70? The good old your good old buddy, the IRS. So when you file your taxes, um, yep, Medicare. If you're on Medicare Part B and the IRS notifies Social Security that you made over, if you're single, over $103,000 last year or 2 years ago, then you'll get the extra Part B IRMA premium. It's IRMA's income related monthly adjustment amount. All right, what else? Let's see. What is the average cost of Part A and B plans? Well, Medicare Part A is zero if you paid into Social Security or if you paid into Medicare for 10 years. Part B is $174.70. And then there's, I don't like this term, Medicare Part C. I don't think they should call it that. Those are those Medicare Advantage plans, and a lot of those are zero premium. And I talk bad about Medicare Advantage plans because the pre-authorizations and the limited networks and all that stuff. But I prefer everybody to get a Medicare supplement plan, N or a G, but it's just not a reality. I really, really wish it was, because then you wouldn't have to deal with insurance companies and you wouldn't have, limited networks. You can go anywhere you want. But it's just not the reality because people just can't afford a Medicare supplement plan. And because those are anywhere, depending on your area, anywhere from $100, $80, $120, $130. If you're in New York, $300 or $400. So Medicare Advantage is a million times better than not having something. If you just have Medicare Part A and Part B, you really need to have a few $1 million in the bank account because Part B only covers 80%. So if you have $100,000 surgery, you have to cough up $20,000. So unless you're independently wealthy, and if you are, make sure you click the little thanks button down there and buy me a beer or coffee or whatever. But yeah, you got to find something to cover those gaps, either a Medicare Advantage plan or a Medicare supplement. I would prefer you get a Medicare supplement plan so you don't have to deal with everything. But I realize Medicare Advantage is the only other option. So, but if you do get a Medicare Advantage, it just takes a little bit more work. It can work for you, but it takes a little bit more effort. That is, you have to check it on a regular basis every year when the new plans come out to make sure you're in the right plan, because these companies don't get to be billion-dollar companies by being dumb. They change your plan every single year. You're saying, I've been on the same plan for 2 years. No, you haven't. You've been on the same plan for 7 months. Your plan changed effective January 1st, midnight. And you say, well, I'm still paying zero premium and I still got the same doctor. Okay, cool. All right. What happens if you go to the hospital? Well, it's $100. No, this year, $300 you forgot to check. What about an MRI or CT scan or specialist? Oh, it's this, that, and the other. No, it's triple that now. You didn't check. So please check. And so reach out to your broker or agent. I prefer brokers because an agent, a captive agent specifically, is the old Henry Ford thing. You can have any color car you want as long as it's black. So an agent, a captive agent, works for one company, and guess what company they're going to recommend? Their company. A broker works for you. A broker is contracted with several different health insurance companies, Medicare insurance companies in your area, and you tell them, here's my doctors, here's my prescriptions, here's what I want, and they look out and they find the best plan for you, and they say, okay, here's my recommendation, but here's 2 or 3 others, and then you make the decision. So they work for you, and then again, you don't have to pay them for that. If you decide to use them to enroll, then the insurance company pays them directly, and it's the same exact cost. If you say, well, I'll just contact the insurance company myself and do it directly, it's the same exact cost. exactly the same. So there's that. Let's see here. Kevin, with a 60-year-old who has an 8-year-old child getting SSI. SSI is a welfare-based program, so you probably you might be SSI. When the parent turns 62 and possibly wants to collect their own Social Security benefit, will the SSI disappear or for the son, or does the SSI get reduced? All right, yeah, with SSI, that's a welfare-based program, so it really depends if the person lives with you and your income and all the rest of it. So when the parent, okay, so I'm assuming this is actually SSI. So when the parent turns 62, then the child is eligible as an auxiliary child, 50% of the mother's primary insurance amount, the amount if they had waited till their full retirement age. So it depends on how much that is, depends how much the mother's benefit amount is, but the auxiliary child benefit will offset whatever gets from SSI. So if the child gets $500 from an auxiliary child based on a retirement, then about $500, usually there's like a $20 break in there. $500 will be reduced from SSI. So you'll get the $500 plus another 443 or 463 from SSI. So get both possibly. But if it's more than 943 or 963, depending, then yeah, the SSI will stop. I agree with you on supplement insurance to help that 20%. Yes, yes. I wish it, the thing is that, it's economies of scale. If everybody got some, Medicare supplements, then they would, probably cost, $30 a month. So that's why, I would recommend, Medicare do like a Medicare plan, part F. So everybody can do it. So if you got everybody in the country getting that supplement to cover the 20%, then, it would only cost, 20 or $30 because you have so many people. And there's not a profit, you know, eh, part in there as well. So, but once I'm duly elected as dictator for a day, I will do it right after the cure for male pattern baldness. Once approved for SSDI and are eligible for Medicare, does one have to pay part of the premium for that policy? Yes, you have to. Part A is free. You paid SSDI, so that means you also paid Medicare. Part B, yeah, you'll have to pay that monthly premium, the $174.70. But if you have health insurance from work, your work, or your spouse's work, and your employer has 20 or more employees, then you don't have to sign up for Part B. If you're having a hard time paying for Part B, then you can reach out to Medicaid, your state social services, and yeah, they can see if they can pay for your Part B. All right. And yeah, Carol, I responded to your email about deemed filing. Yeah, this was a law that deemed filing. It changed the whole file and suspend thing. Was it 2016 that the law changed? And it depends whether you're uh, born before 1954 or after 1954. It's completely different. And I don't know if I should say this. Even the after 1954, the computer system, Social Security computer system, didn't catch those. And yeah, that whole thing is, yeah, it's a nightmare. They really need to simplify it, and I don't think it's, particularly in terms of independently entitled divorced spouses, I don't think it's fair at all. So hopefully someone sues and gets a good judge to change that. Yeah. So, but yeah, let me know how that works out. But the deem filing thing. All right. Everyone needs to hit the like button. Yes. Yes. Thank you. I appreciate it. Yeah. Who are brokers? Sorry. Yeah. Yeah. There's thousands of Medicare insurance brokers throughout the country. And I've got a team that I work with that is really, really good. And yeah. So if you need help, click the little the link I put in the chat, and then request an appointment. and we'll have somebody reach out to you. With my Advantage plan, should I be paying a premium because another agent can't figure out why I was to pay for the plan I'm in now? So premium. So if you're in a Medicare Advantage plan, you'll always have to pay your Part B premium, the $174.70, unless the state is paying for it for you. But yeah, you'll always pay for Medicare Part B. A lot of Medicare Advantage plans have zero premium now. They can, again, these are all, they change every year. So maybe they're getting that zero premium now, and you're in there, and it's hard, if not impossible, to switch to a Medicare supplement plan later. And so you're kind of stuck in Medicare Advantage for the rest of your life. And then, 5 or 10 years later, then yeah, there's no telling what's going to happen. But yeah, if you're paying a monthly premium for your Medicare Advantage plan, then it really depends on your particular area. Maybe there are no other Medicare. You live out in the country or a desert someplace, and there's no other Medicare Advantage plans in your area that are zero premium. So yeah, it really depends. So if you want help, click that little link there, and I'll have one of my people reach out to you and see if it is accurate. I read that Part B will be 184 in 2025. Yeah, we don't know. It'll definitely, yeah. I'm not sure who said that or how they would know. But yeah, that would be nice. $10 only. Well, $10. That's, I guess that's about average. That's okay. Yeah, that'd be okay. So it's $174 now, and so $10, $9 increase. That's on par for the course. That might be pretty accurate, but nobody knows. Nobody knows. All right. What do you do if the attorney you hired acts you are not going to qualify for SSDI before you're okay? Yeah, I'm not sure. Yeah, if you're not happy with your the lawyer you hire for your disability case, then you can always unceremoniously let them go. But sometimes they submit to Social Security that they work this amount of money, so they get however much percentage if you are approved and stuff like that. So they can ask for that from the judge. Sorry, I meant the Advantage plan, not the Part B, and I'm paying 184 now. Sorry, I meant the Advantage plan, not the Part B, and I'm paying $184 for an Advantage plan. Wow. Yeah, that's I've seen them, 20, 30, 40, $70 or stuff. But yeah, I mean, there are Advantage plans out there for, $100 or so. But if you're stuck because there's not much competition out there, and it's going to get worse too, because there are health insurance companies, Medicare insurance companies that have already notified that, hey, we're pulling out of particular areas because we're just not making enough, money or profit or whatever. So they're going to be pulling out of areas. So that might be an opportunity. So if you ever thought about a Medicare supplement plan, and you're not able to get it because of health writing, if your plan pulls out, you might have a special election period where you can switch to a Medicare supplement plan without underwriting. So yeah, does definitely would like you speak with a broker. Yeah, I think there is the link. Click on that, and yep, we'll hook you up with someone. I am an independent employee, 1099. After listening to your video, I checked my earnings record in SSA. You probably mean SSA, and it showed zero for the last couple of years. I am filing my tax every year. How can I check? Yeah, when you're self-employed, and you file your taxes, you might need a new accountant, or you expensed everything and you've got zero profit. If you got zero profit, then you can't pay, it's because it's based on your net income. So if you don't really make anything from your company, you're expensing it all out, then yeah, you're not going to pay any FICA because you only pay it based on your W-2 wages or your net income. But if you do have profit from your company for the last 2 years, and you're not paying FICA, then yeah, you need to find possibly a new accountant to do it correctly. And you can go back in there and file an amended return and get that fixed. All right, it's over an hour, and all right, so that'll do it for today. I will be back again tomorrow. So if I didn't get to your question, make sure you join me back again tomorrow and tell your friends and family and all that kind of good stuff. Let's make